Ginger is celebrated all over the world for all of its health benefits. From soothing digestive issues to alleviating nausea, this root has been cherished for centuries. However, while it's often hailed for its therapeutic properties, there are circumstances where ginger should be avoided. In this video, we will dive into the instances where ginger might not be the best fit for your health, helping you make informed choices about its consumption. Understanding these situations can ensure that you harness the best of ginger's benefits while safeguarding your well-being. Let's jump in and talk about the 9 occasions when to avoid ginger. Number 1. Bleeding disorders. If you have a bleeding disorder, it's crucial to be cautious about your diet. Ginger is known to have blood-thinning properties, which could exacerbate bleeding in individuals with bleeding disorders. While it's a popular spice and herbal remedy for various ailments, its potential impact on blood clotting makes it a concern for those already prone to excessive bleeding. The active compounds in ginger, such as gingerol and salicylate, possess antiplatelet and anticoagulant properties. These components can interfere with the body's natural clotting process, leading to prolonged bleeding and potentially worsening the condition in those with bleeding disorders. It is vital for individuals with such disorders to consult their healthcare providers before incorporating ginger into their diet. Healthcare professionals can provide personalized guidance based on an individual's unique health profile and the severity of their bleeding disorder. Number 2. Diabetes. Ginger has been observed to potentially lower blood sugar levels. Although this may be beneficial for some, it can pose risks for people that are already managing their blood sugar levels due to diabetes. Sudden drops in blood sugar can lead to dizziness, weakness, and even fainting, making it crucial for diabetics to monitor their ginger intake closely. Moreover, ginger has natural blood-thinning properties. While this can be beneficial for people with normal blood clotting function, it can be troublesome for diabetics who may already experience issues with blood clotting due to their condition. Excessive ginger consumption could further exacerbate this problem, leading to potential complications. Furthermore, some diabetics may experience digestive issues when consuming ginger. Ginger, known for its ability to stimulate the digestive system, may cause discomfort, bloating, or even worse than existing digestive problems. In these cases, this can lead to further complications in managing diabetes, especially when gastrointestinal disturbances can affect blood sugar levels unpredictably. Number 3. Gallbladder issues. When the gallbladder is not functioning optimally, it struggles to efficiently release bile, which is vital for digesting fats. Ginger, being a naturally spicy and pungent herb, can stimulate the production of bile in the gallbladder, potentially causing discomfort and worsening the condition. Since it has strong blood venting properties, ginger could pose risks for those with gallbladder problems, as any complications in this delicate organ can lead to bleeding and other serious health issues. Even though ginger is celebrated for its anti-inflammatory and antioxidant properties, people suffering with gallbladder issues should approach its consumption with caution. It is advisable for them to consult a healthcare professional before incorporating ginger into their diet, as it could potentially aggravate their symptoms and hinder the healing process. Opting for other soothing and digestive-friendly alternatives, such as chamomile or peppermint tea, may be a safer choice for individuals looking to manage their gallbladder issues without worsening them. Liking my video so far. Before I move on to the next condition, don't forget to hit that like button and subscribe to my channel so you never miss out on my new informative videos. Number 4. Heart conditions. For those dealing with heart conditions, the use of ginger might pose certain risks. This is primarily due to its potential effects on blood circulation and blood pressure. Ginger has been known to possess properties that can stimulate blood flow and improve circulation, which could lead to an increase in heart rate. For individuals with pre-existing heart conditions, This could potentially worsen the issue and result in adverse cardiovascular effects. Moreover, ginger has natural blood-thinning properties that can affect the blood's ability to clot. While this might be advantageous for some people, it could be problematic for those with heart conditions who are already taking blood-thinning medications. The combination of ginger with these medications might further thin the blood, leading to complications such as excessive bleeding or bruising. Number 5. Medical interactions. Individuals taking certain medications should be cautious. This is especially important for those on blood clotting, high blood pressure, and diabetes meds. They need to consider how ginger might interact with their medications. Ginger's natural properties can thin blood and lower blood pressure. This might affect how their medications work. It could lead to unexpected results and health problems. Additionally, people on certain medications for blood clotting, such as warfarin or aspirin, need to be vigilant about their ginger intake. Consuming ginger alongside these medications might intensify the blood-thinning effects, resulting in an increased risk of bleeding. For people on medication to control blood pressure or diabetes, ginger can affect blood pressure and blood sugar levels. This may cause unpredictable changes, potentially undermining the efficacy of the prescribed treatments. No. 6. Being underweight. Ginger is often celebrated for its potential to aid digestion, reduce nausea, and alleviate inflammation. Nevertheless, its natural properties can inadvertently contribute to challenges for people striving to gain or maintain a healthy weight. The primary concern arises from ginger's ability to stimulate the digestive system. It can increase the production of digestive enzymes, potentially leading to a faster metabolism. This may result in a decrease in nutrient absorption. For those trying to maintain a healthy weight, boosting their metabolism can make it harder to consume enough calories. Ginger's appetite-suppressing potential might worsen this issue. People struggling with being underweight should consult a healthcare professional or a nutritionist for dietary advice. While ginger is beneficial for many, those dealing with underweight concerns should be cautious and explore alternative options for managing their weight effectively. Number 7. Pregnancy. Some studies suggest that consuming high doses of ginger during pregnancy could potentially increase the risk of miscarriage. Therefore, it's advisable to stand on the side of caution and moderate ginger intake, especially in the first trimester when the risk of miscarriage is comparatively higher. Moreover, ginger's ability to act as a blood thinner might affect the clotting process, which could pose concerns during childbirth or any related procedures. This could potentially lead to increased bleeding, creating challenges during delivery or even postpartum. Despite its many benefits, ginger may also trigger issues like heartburn and discomfort for pregnant women, particularly those who are prone to gastrointestinal distress. Given these potential complications, it's recommended to consult with a healthcare provider before including ginger in your diet during pregnancy. In essence, while ginger can be a valuable addition to a healthy diet for non-pregnant women, its consumption during pregnancy should be approached with care and awareness. Prioritizing regular consultations with a healthcare provider and maintaining moderation and conception can significantly reduce any associated risks. By staying informed and mindful, expecting mothers can make informed decisions about their dietary choices, safeguarding both their own well-being and that of their developing child. Number 8. Low blood pressure. The active components in ginger, such as gingerol and zingerone, are responsible for its unique properties. These compounds act as vasodilators, widening blood vessels, and subsequently causing a drop in blood pressure levels. For those already dealing with low blood pressure issues, the consumption of ginger can intensify these symptoms, making it imperative to exercise caution. Moreover, ginger's ability to stimulate the production of certain hormones and neurotransmitters, such as serotonin and norepinephrine, can potentially contribute to a further decrease in blood pressure. This psychological response can have adverse effects, particularly for individuals prone to experiencing sudden drops in blood pressure. Number 9. Surgery. When preparing for a surgical procedure, you need to consider certain foods and supplements. These items might interfere with the body's response to anesthesia and other medications. This interference could happen during the operation. Ginger may heighten the risk of excessive bleeding during surgery, potentially complicating the process and increasing the likelihood of postoperative complications. Moreover, ginger has a natural ability to affect blood sugar levels. This poses a challenge for individuals with diabetes. It might interfere with the regular insulin intake. This interference could cause fluctuations in blood glucose levels during the surgical procedure. Maintaining stable blood sugar levels is important for a successful surgery and a smooth recovery process. Healthcare providers typically advise patients to refrain from consuming ginger, considering the potential impacts of ginger on blood clotting and blood sugar regulation. This includes ginger in the form of supplements, teas, or as a culinary ingredient. It is recommended to do this at least 1 week prior to any scheduled surgical intervention. This precautionary measure aims to mitigate any potential risks and ensure the optimal safety and well-being of the patient throughout the entire surgical process. To sum things up, ginger is a versatile and healthy spice with many benefits. However, it's essential to be aware of situations where it's best to avoid ginger if any of the issues mentioned apply to you. It is important to seek advice from a medical expert before adding ginger to your meals. Thank you for watching.